Well, for most people, as we know, most people who get COVID-19 do fine. But about 20% of people, about a fifth of people end up in the hospital, and about a sixth of those end up going on to the ICU. And once people are in the ICU, um, rates are very grim. Now, those are overall numbers. Things have gotten better since the beginning of the pandemic, especially in that later part. We're learning how to care for people better. Even there are some drugs, but there's also just kind of doctors learning what to do. But that's kind of an overview of what happens. People tend to go to the hospital when they're starting to not get enough oxygen from their lungs, particularly when their O2 goes low through a finger devices that a lot of people have now.
Yeah, we have on the screen, I apologize for that. We have on the screen the progression of this. This is not to say that everyone does this, but this is the progression as noted by the scientists and how it works. So go ahead, if you would. I'm sorry for interrupting.
Right. Well, the other thing to emphasize here is that all of that for any individual is pretty unpredictable. What docs have said from the beginning of treating this disease is that they often don't know what's going to happen. Patients they think are doing well don't. Patients that aren't doing well sometimes mount a recovery. That's one of the things that makes it hard to test medicines against a disease like this.
Let's talk about the spreading. We've just gotten a report from David K. Lee of NBC News that at least 11 positive coronavirus tests can now be traced specifically to the presidential debate in Cleveland. Now, keep in mind the context of this. That was an empty hall, except for those who ran the debate, the families of the two participants and invited guests, Chris Wallace, the moderator, and his family and invited guests. It was a very small crowd, and yet 11 people have tested positive from that one event. There have been multiple events before and since. Before, we had the big event at the White House for the Supreme Court nominee, and since, we've had the fundraiser at Bedminster in New Jersey, and all of the people who flew on the plane with them. If you could help our audience understand how this virus ripples and how each person who contacts it and then becomes in contact with others can cause just ripples across the landscape.
Well, I think that, again, it's important to remember this virus is unpredictable. But I would go back to the Biogen event that happened back toward the beginning of the pandemic, where you really saw that was a biotech company. Those are people who knew biology. And it was a corporate event of top executive leaders. And I don't remember the numbers offhand, but a lot of people at that event caught COVID-19. And then they went back out across the country and brought it to lots of other places. And sometimes events become spreader events and sometimes they don't. And researchers I've talked to haven't really got a full explanation of why. But certainly in a case like that, where you've got people in a confined room, the virus can spread. That's the reason for the guidance about doing things outside if you can, the reason for wearing masks, the reason for keeping a social distance of at least 6 feet, to reduce all those risks. And all the things we talk about, from masks all the way up to if we get a vaccine, they're really about reducing risk, not eliminating, and you're layering one reduction on top of another in order to protect people. So if any of those steps fall down, you're less protected. You need all of them. It's not like there's one magic bullet for anything about the coronavirus.
The stats on this age group, and I'm just reading them from our research department, 65 to 75 years old, the CDC's looked at 5.23 million cases where that age is available. The 65 to 74-year range is particularly susceptible and has had particularly bad outcomes.
That's absolutely right. I mean, you can get varying estimates, but the risks are highest for people in the older age groups. And in fact, if you look at if you have a chart of them going up, they go up. It's very dramatic. The risk goes up pretty quickly.
When you look at the events of the last couple of days, it's one thing, you're wearing a mask, you get the virus, but you wear the mask all the time. You can track the virus, you don't know you have it for 8 days, but since you always wear the mask, your risk of spreading it is much less. But if you don't wear the mask at all, the risk of spreading it is much, much greater, correct?
That's what we think, yes. For masks, we don't have the same kind of randomized data, but the data we have seems to indicate population-wide that if people are wearing masks, you get a lot less transmission. And that's what would follow from, right, the physics of wearing a mask.
Yeah. Matt Harper from statnews.com, a great source for factual statistics about this virus, if you're interested. Matt, appreciate it. Thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.